since we're at a women's conference, on some of the most exciting things I've ever seen. Now, I'm going to be a little cautious here because I've been disappointed before. And in research, you know, you roll the dice, you hope that it comes out down the line. But I'm going to ask all of the women here, you men can answer the question too if you would like. When you were pregnant, did your pain get better? When you delivered a baby, did you get the job done? Anybody in this room besides me delivered babies professionally? A couple of you? I always wonder how you could do it, because all I did was sit there and look at all those tears and all the bleeding, and I said, how in the world can you live through this? They did. And what I'm about to tell you is, in a way, kind of sad, because in the basic science literature, meaning those people who hide down in the basement at USC and UCLA and never come up for air except once every 6 months, their only friends are rats and hamsters, have actually done some great work, and they did a lot of it 20 years ago. It's just that us dummies in the clinic, we just didn't pay any attention to it. What am I getting at? I'm going to tell you a little vignette and close it out. It's now been about 5 years ago that I had a nurse practitioner who worked for me in a clinic that I owned up in Fresno. And she did a lot of weight work, and she called me one day and she said, Dr. Tennant, I'm giving all these patients HCG. Now, they're not losing any weight, but their fibromyalgia is getting a lot better. And she said, what do you think about that? And I said, I think it's a hoax. I don't believe it. So I go up to Fresno. Now, incidentally, if you've ever driven 99 Highway once, you've done it. And anyway, it's a long, boring drive to Fresno, as you know. So I go up there, and I talked to the first 3 or 4 people who supposedly were benefiting their fibromyalgia or arthritis due to HCG. I didn't think too much of it, but after about a dozen people, I said, I think there's something here. So I started looking in the literature. I found out that some years ago there was an Italian physician who used HCG on arthritis and neuropathies and got tremendous results. And then I looked up those basic science people, the guys chasing the rats. Turned out they had taken rats, cut their spinal cord in half, watched the rat drag around the cage with their back hind end dragging, and gave him HCG and the spinal cord regrow. I said, there's something here. And then I recalled all the pregnant women I had seen whose pain and addiction almost went away when they were pregnant. And why? During pregnancy, your HCG goes off the roof. What's HCG in pregnancy? It goes up along with some other hormones, but it goes up because HCG is the hormone in males and females that grows nerve tissue, skin, hair, and nails. It's called the ectoderm. So 6 years ago, we started giving it to pain patients. It took a while to work out the dosages. We've now had some people on it 6 years. And for the first time, I started seeing people who were really taking a lot of opioids, severe intractable pain patients, reducing their dosage, pain down, and it was something to see. And then I had another situation recently. I had a mother bring a young boy to me, and they came down from Santa Cruz, and he has something called Ehlers-Danlos syndrome. Anybody know what that is? That's sort of the rubber man syndrome where you can put your arm behind you and what have you. Well, this little young boy, he could turn his whole leg around, and they'd tried every opioid in the book. It didn't work. I ran genetic tests on him. He had all kinds of genetic defects. But now this mother may not be known to you, but it's known to doctors. This is one of these mothers with a master's degree, spends all her time on the computer, reads everything, and is kind of pushy and doesn't take no for an answer. You ever meet anybody like that? And so she comes down and she tells me, she's in a Dr. Tennant, I know you're a renowned man, but we don't really think you know what you're doing. I want you to give my boy oxytocin. I says, oxytocin? But he's not breastfeeding. He's not delivering a baby. At the time, all I knew about oxytocin was what I remembered from my days of being a general practitioner and delivering a few babies, that your oxytocin went up at the time of delivery, and I thought it was for uterine contractions. And I thought when you nursed a baby, it was to bring the milk down. Well, it may do those things. But making a long story short, the studies are now pretty clear. And again, those guys down in the basement with the rats have done studies that are embarrassing to read because they're 20 years old. Turns out that we've been mislaboring under the belief that the endorphins were the major internal pain relievers. It's not. It's oxytocin. Oxytocin is a pure pain reliever. Okay. In fact, it looks to me like much more potent than endorphin. It looks like it's sort of a Lyrica or a gabapentin, but about 10 times more potent. And it does not, and it cuts off pain signals at the brain stem, and it's very potent. Anyway, I told the mother, I said, well, I don't know what the dose is, but I'll make a shot at it. So I did a little studying, gave him an experimental dose. They called up 3 days later and says, works. He's totally out of pain. And I said, I can't believe that. At any rate, make a long story short, oxytocin goes way up at the time of delivery, not so much for uterine contractions, but to give you enough pain relief you don't die. It goes up when you breastfeed, I assume, because a lot of those little rascals really can be brutal to breast, I assume. I also didn't know that men also make HCG and oxytocin for the same reasons, and it's made in the pituitary gland. We didn't even know until the last 5 or 6 years that men made these things. But we now know that in all of us sitting here, oxytocin and chorionic gonadotropin are in all of us. They're major for us in both growing nerves and relieving our pain. So what have I done lately? I said, gone this far. I might as well give a few people both of them together, including some men. So I've induced pregnancy in a few men. It's early, but I do want to tell you that it's great hope. No question about it. You'll hear a lot about hormones and pain. I don't have all the answers yet, but it is early. And to close, I just want to say this. I hope you get my enthusiasm. I salute you for being here. And incidentally, you know, when you're from L.A., I go traveling around, and you know, California has a lot of problems. But I even wear a suit and tie when I'm from California. They're shocked. They think I'm in, they think I should be wearing Bermuda shorts, and I tell them I have a wife. That gets to them. Anyway, but I'm only half joking. We've still got the best brains here. We've still in medical technology and in the medical fields. And we certainly need a group like you, because a lot of you got the problem, you're interested in it. I've got a lot of things you ought to be doing. I've been very involved in this FDA debate over the opioids, and I don't know that you know, they made a final ruling yesterday on long-acting opioids. It's going to affect all pain practices. In my opinion, it was a good ruling. We're not going to lose the opioids. They are going to start putting out under what conditions long-acting opioids can be used, and fundamentally it's going to turn out which doctors can prescribe them. Okay? So we've got some things coming. You need to be aware of these things. I'll be more than happy to join you. You've been a lovely audience, a lot of fun. I salute what you're doing. I'm proud to be a small part of it.